let the committee know that sign a the governor did sign a executive order to extend the state of emergency. Presently, it's going through June 11th at this point. So I'll turn it over to Larry to talk about operations and food delivery and vehicle cleaning.
Good afternoon.
Larry.
Yes,
Good
sir.
afternoon.
How are you? Good. So food delivery is still going well. We're delivering 4 days a week. And, every week they add a couple, they take a couple off, but it's still going well. We're delivering about anywhere from 85 to 90 a week. This week we started with the COVID testing. We got most of the staff that work here in the building done on Thursday. I know they did Comet staff on Tuesday, and right now I'm working on getting a list of all of the operators and mechanics so that they can be tested on another date. So I'm glad that is going forward. The cleaning to be going very, very good. With the additional supervisor that we have at night that is not only monitoring them as they go through the service line, but he is then checking them once done cleaning and sending them back if they need to be sent back, and then signing off on each and every bus, essentially saying these buses are clean, and being held accountable for each and every one of those buses. It seems to be going very, very well. In fact, we're getting compliments from the operators telling us how clean our buses are.
Right. And let me ask a question, may I, Mr. Chair?
Go ahead, Leo.
When do we expect to get some results from the first testing?
This is Leroy.
Yeah.
As far as the testing we did on Tuesday by Lovelace Family Medical, all of those results were negative.
Right.
Also, too, they do a follow-up call with the person also. So that was done yesterday. And also from the ones on yesterday, Larry, have y'all gotten any contact?
No, not yet.
Yeah. And in speaking with with Dr. Henderson, that's over the program that's here, he says just based on their volume, sometimes it's the results are back in 24 hours, but no more than 48 hours. But with them just getting around to calling and notifying, it's taken a little bit of time. They're continuing to look at ways to streamline what they're doing. But we've so far, we haven't gotten any positive ones. And I'm quite sure through today and Monday, they'll be following up on the ones that were done yesterday on Thursday.
That's very good news. Thank you.
You're welcome.
Yeah, sure. That's great news. Larry, let me just ask you a question. The cleanliness of the buses.
Yes, sir.
At one time, we were having some problems with that. What do you attribute this turnaround to?
A couple of things. When you are re-instructing people on the importance of something that needs to be done, correcting bad behaviors that they had developed, it took some time to kind of get them on the right track. But I think the biggest thing that has gotten them turned around is that constant supervision, somebody there, just to make sure that they're doing what they're supposed to be doing from the beginning to the end of their shift. And then, like I said, checking those buses once they're done and then sending them back if they need to be cleaned, or something needs to be corrected. That supervision, that layer of supervision, I think was kind of that cleanliness of the buses up to the standards that they needed to be.
Okay. Thank you very much.
Mr. Chair.
Good news.
Mr. Chair.
Yes, sir.
Mr.
Go
Chair.
ahead, Darren. Yes, sir. I recognize
Okay,
Darren.
I understand. I understand the level of supervision and what that means, but I must go back to the drivers themselves, because they're the ones on the front line, and they're the ones taking all the right steps to ensure that they don't get infected or get their passengers infected. So I do agree supervision is important, but I just want to note that the drivers are ground zero, and the drivers are the ones that's making sure that this thing continues to operate. So that's my point. Thank you.
Excellent point. Thank you. Excellent point. Anybody else? Okay. Well, that's it.
Larry,
Go
can you
ahead.
talk about how operations on the street has been?
Yes, sir. So one of the things that we have been doing daily is monitoring for instance, the full buses. Even when we increased the service from Sunday to the Saturday, enhanced Saturday service, we were still seeing full buses. And all on the same lines, 101, 501, 401, 701, 801. Those are the routes that are still being reported full every day. And so, like I said, we are still monitoring that daily, which we're looking at to see what we need to do to alleviate those full buses. We're talking about several things that we could do. Put into place to fix that. And I think John's going to talk about that. But yes, we don't get a lot of calls of people being left by a full bus, but we are getting the full bus calls every day.
Okay. That's good. Anything else, John?
So are you noticing, do you have a noticeable then increase in ridership? Is that what you're experiencing right now?
Well, yeah, because people are going back to work and places, retail stores and restaurants and places are opening up. So yes, we're definitely seeing an increase because, when we were on the Sunday service, we were getting a number of the full buses reported. And even with the increased service, we're still getting full buses.
Yeah.
That is in part to, and ridership going up, but it's also the social distancing that we are still, placing on all of the buses. That's one of the reasons why those buses are full. We're limiting them to 61 on the buses.
Okay, right. Anything else?
So just for clarity, so that the committee is aware, the routes that are experiencing the fullness are our traditional routes that have always operated every 30 minutes, which we're doing today. So when we go into the next agenda item, I believe we've been talking daily about how we can continue to modify our operations while keeping us safe. This proposed policy will help address some of those issues. I understand there's been some concerns about full buses that we're operating.
May I ask one more question?
Recognized.
Larry, this is for you too. Have we experienced any disruption of service because of the crowds that are downtown? I mean, I know the first night about the curfew and all, but since that time, have we experienced any disruption of service?
No, ma'am. Aside from Sunday, when we suspended service on soda can as that downtown blocked off, we haven't experienced any problem. No, ma'am.
Great. That's good news too. Thanks.
You're welcome.
Yeah. All right. Anything else, John?
That should do it with this agenda item, Mr. Chairman.
Okay. Sounds good to me. Okay. Next item on the agenda, item 4 Bravo, 4B. Recommendation to adopt a COVID-19 operating policy, pages 22 through 25. John, you take the lead on that one?
Yes, Mr. Chairman. So we've drafted a COVID-19 operational policy that we would like this committee to adopt. The intent of this operational policy will guide our operations for the foreseeable future until we can get into a state where we can get back to how we were operating pre-March 13 of 2020. This policy would apply to all of our vehicles and our facilities. And the key highlight of this policy is, one, that we would recommend that everybody wear a mask when riding a Comet vehicle or accessing a Comet facility. We define a facility as Comet Central or the Lowell C. Spirals Regional Transit Facility. We also define wearing a mask, meaning by covering your nose and your mouth. This policy would apply to all passengers and employees unless a reasonable modification request has been filed and approved by our Director of Regulatory Compliance or designee. For passengers, or a reasonable accommodation request has been filed by the employee with the Comet or the contractor and approved by the Director of Administration and Operations or designee of the Comet. We are suggesting that masks are not required in an individual environment such as an office, police, support, administrative vehicle, or when deadheading a bus when there's no second or more persons in that environment. To help with implementing this policy, we would purchase and provide masks for an initial 45-day period. The masks would be available on a bus next to the rear door of a transit or trolley bus or the front door of a cutaway bus and van. Starting in August, after we distribute these initial set of masks, we would require passengers to provide their own masks or ask for one. Limited supply would be available at Comet Central or the regional transit facility during operating hours. The vehicle would not move until passengers are correctly wearing a face mask covering the nose and mouth. The exception would be for individuals approved to not wear a mask or face covering. So the next section talks about that with implementing of the mask, we would eliminate the skip a seat arrangement to allow us to fill the capacity of the bus. Phase one is where we would basically fill the bus to its maximum allowable capacity, which is shown on that table. Phase two would include adding standees, but we would implement phase two at a later date. We would like to just see how safe we can do this without crowding the bus and putting too many people on at a bus. So we've counted the seats in every bus type that we have or vehicle type at the Comet. So that gives you an idea of how many seats would fit in every vehicle. We are still operating large buses on all fixed routes with the exception of routes that carry 3 passengers or less. And since we only have 39 large buses and 2 trolleys, at times we do have to put out cutaways to cover when buses are in the shop. The next column about the standees is standee recommendations that are pulled from what is called the Altoona Bus Test Report. Every bus that operates in public transit has to go to Altoona, Pennsylvania to be tested and certified, and then they also certify the maximum number of standees that could be on that bus. So if we go to phase 2 and we're comfortable with phase 2, then we would implement that. Until bus operator barriers are installed to protect the bus operator from interacting with boarding and exiting passengers, front door boarding would be reserved for seniors and persons with disabilities on the large transit buses that have double doors. To reduce the potential for overcrowding, the one-way travel policy would still be implemented, and we would ask passengers to deboard at the end of the line and reboard again to ensure capacity is not exceeded. Exclusions are allowed when a passenger boards on a one-way route segment or at a turnaround loop on a route. The Comet will provide also hand sanitizing wipes or spray bottle of disinfectant and dry paper towels, as well as hand sanitizer dispensers inside all buses and facilities, and the contractor will be responsible for its refill. And then hand sanitizer dispensers will be placed in an area accessible by all passengers. We'll continue to have a trash stand placed by the contractor near the rear doors of buses or front door of cutaways and minivans. This policy also includes a no tolerance for violence. If any dispute occurs between a passenger and an employee of the Comet or its contractors regarding passengers not wearing a mask, wanting to wear a mask, or in the facility owned or controlled by the Comet, we will take the following actions. The bus will not move, and the bus operator will contact dispatch to request a supervisor or police assistance. if the passenger doesn't want to comply with this policy. In the case of facilities, police or security will be called. If the visitor does not want to comply with the policy, we'll put signs on all the buses and facilities to state no trespassing to ensure that when persons do not follow this policy, they can be subject to trespassing in accordance with the City of Columbia's municipal code related to trespassing or disorderly conduct. That would allow our contracted police or any police officer to issue a citation and possibly arrest if they're going to harass any of our employees or contractors. We would waive the on-time performance requirement for the contractor when situations occur that result in delay of service due to passengers' non-compliance with this policy. We would reopen Commerce Central and have no more than 17 customers allowed in the building at any one given time per the Executive Order 2020-28, limiting customers inside a business not to exceed 5 customers per 1,000 square feet, or 20% of the occupancy limit as determined by the fire marshal, whichever is less. Commerce Central is 3,400 square feet, so the occupancy is 159 people per the fire marshal. Employees interacting with customers will be required to wear face masks. Customers entering the facility will also be required to wear face masks, and we'll have private security monitor the ingress and egress of customers in Commerce Central. We would continue to run the enhanced Saturday level of service on Monday through Friday until the state of emergency has been lifted by the governor of South Carolina. At that point, the board of directors would review the environment to determine if and when to add the remaining suspended routes back into service in transition to a normal weekday schedule based on information presented by the executive director. We would continue with the suspension of fare collection provided until the state of emergency has been lifted by the governor, and then at that point, the board of directors would review the environment to determine if and when to resume charging fares based on the completion of installation of a barrier to separate bus operators from customers that does not obstruct the bus operator's vision in the operation of the bus based on information presented by the executive director. The comment will continue to enhance detailing on its vehicles 4 times a month, which includes fogging and steam cleaning, and we will pay any extra costs to our contractor. The comment will continue to enhance cleaning of its facilities, including bus shelters and bus benches daily, as long as this policy is in effect, and pay any necessary costs to the contractor. This policy will be reviewed by the board of directors every 3 months, starting September 30, 2020, or more frequently if warranted, for continued applicability until the Center of Disease Control, or DHEC, has determined that the coronavirus pandemic is over with relaxed restrictions regarding the interaction of the people with people. So with that, I'll be happy to answer any questions on this proposed policy.
Well,
Mr. Chairman.
I'd like to ask you a question. Okay, you're next, Leo. John. Okay, we're all together. Okay.
Yes, I'm here.
Put your phone on mute, please. Yeah, my question is, we're requiring, somebody needs to put the phone on mute or something. We can't hear.
No, we hear you fine, Mr. Chairman.
But I can't hear anybody. I can't hear anybody but buzzing sound. All right, here we go. My question is this: we're going to require people to wear masks only until we're going to require them to wear masks, but we're not providing masks. Do you think there is any way we can continuously provide masks? So, because I guarantee you, lots of people are going to forget. They're not going to bring it with them, and they're going to get there and they're going to be disappointed when they get to the bus terminal, bus stop. So, what do you think? Do you think we can just provide masks through the duration of this thing?
To be honest, Mr. Chairman, I'm not sure. Let me ask if maybe Mr. DeChamps could talk more about that. I think supplies are very limited. STA is going to be donating 1,000 masks to us, and our staff is looking to buy as many masks as we can. But I guess the concern when we talked internally about this was if we run out of masks and we have this, and we're advertising this obligation, how do we respond to that? So, Mr. DeChamps, do you want to add anything to that?
Well, we've started looking into, like according to the policy, we looked at offering masks for the first 45 days from June 15th to through the end of July. And what we were looking at as far as the dispensers that will have to be used, and our concern there is when the rider gets on and say, for example, they don't have a mask and they have to get one, of making sure that dispenser only dispense or allow them to get one mask or to keep them from putting their hands in and maybe contaminating more than one. And when we looked at trying to maybe get individual masks where they're individually wrapped, it does get pricier that way. And we've been looking at the prices for that and looking at the different dispensers. I know, Tanisha, if you've got some prices, maybe you can share those, or have you gotten any information back on that?
I do have some, because the masks are gonna have to be individually wrapped. Individually wrapped masks cost a little more than just buying a bulk of masks in a box and then putting them in a dispenser. And we already have to kind of judge everyone. Everyone, some people may take one, but because there's not a lock-in dispenser or a dispenser that would, where you can just pull one, if you could ensure everyone would take one, that would be a little easier. But for pricing, let's say for instance, they have individually wrapped masks in a box of 20 for $79. There's some bulk orders where you can get individually wrapped masks. The only one that I've seen is probably $100 at $90, and that's a company out of Florida. So that's probably the best bargain that I've seen, but individually wrapped mask is pretty high, and I don't see how we can get away with not getting individually wrapped, and we're putting them in a dispenser to put on the bus.
Okay.
So now I have a kind of a series of questions following that.
Okay, ma'am. Are you there,
You want me to
Leo?
go ahead? You want me to go ahead?
Yeah, go ahead.
Okay. All right. So we're talking about are we talking about reusable masks here? I mean, reusable for the individual. Here's what I'm thinking. Is there any possibility that we have? I mean, this is really a big investment. It's an important one, but it's really big. And is there any possibility that there are masks that we could, have a repository for people leaving the buses to drop their mask in, and we could re-sterilize them? Is anybody doing that anywhere, John?
Not that I've seen from participating in the APTA conference calls about this.
Uh-huh.
So yeah, I'm not seeing that or hearing about
I mean, I
that.
know that gets you into a whole nother range of things you'd have to do. But the masks themselves, a person could use the mask more than one time. I mean, if it's just for their own personal use. Am I right? Are we talking about cloth mask, or are we talking about paper disposable mask? What are we talking about?
Mr. DeChamps or Ms. Gibbons, if you can answer that.
It was the disposable mask. The disposable masks are what comes individually wrapped. The cloth masks individually wrapped are way more.
So which one are you looking at buying?
The disposable. If you buy the cloth masks, even if we try to reuse them, they have to be re-wrapped to put back into the container.
I got you. I know that would be a huge enterprise in itself. That's true. And so the main purpose that we have for switching to a policy that says we're going to not just request masks, but require masks for people is so that we can ride more people per bus, cut down the space. Right. Did I get that right?
Yes, that is correct.
Because that would let us ride more people.
Yes.
Okay.
And give people a better sense of comfort because everybody is covered appropriately. So they'll more likely wouldn't complain about being next to somebody.
Right. And are you hearing from your public health resources that they have a sufficient comfort with the effectiveness of masks to make people riding in closer proximity safe?
Yes, I am hearing that, and I know CDC has kind of issued some guidance for reopening transit systems, and this is one of the recommendations that they added. I think you may recall seeing that flow chart 2 weeks ago in your board packet.
Right. Okay. So it's not just us hoping that it'll be better, but there's some expertise that says if we wear masks, then it's relatively safe for people to sit closer together.
That's kind of what CDC is stating. Now, of course, they still would like the social distancing for that extra comfort, but in case of the public transit system, it's just not practical or possible.
Right. Okay. And then, of course, when I first read this, I was concerned about how we would handle situations where someone refused, but you went through that very well. So I'm hoping that I'm hoping that there'll be enough peer pressure or support among riders that we won't have service disrupted much, because this is clearly one of those situations that if everybody does the right thing, things go a whole lot more smoothly than if you have one person who objects.
Generally, what happens in situations like that is, you're right, there will be peer pressure, because when the bus doesn't move and the bus operator gets off the bus to make that call, people are going to start getting frustrated with the person that's being non-compliant with the policy, and eventually that pressure enough should get the person either to comply or to leave the bus. And if that still doesn't work, then people unfortunately will just be waiting until police and a supervisor come to rectify the situation. And by having the signs on the buses and the rules posted, it'll be clear that they can't say they didn't know, they didn't understand, because we're going to educate people in advance.
Right.
And that's kind of the purpose of the grace period, is to.
And I hope that our folks that are doing the helping us with the PR and all will really pay attention to how we message this, because I want us to be messaging it to appeal to people's better instincts rather than being a threatening kind of "you got to do this or else" message.
Right, and that's kind of where the education process would come. Ms. Bynum-Reed will be instrumental in facilitating that.
Okay. I think those are my questions about that.
Mr. Chair?
Yes, Derek.
Okay, I noticed, and we want to protect our ridership, we want to protect our drivers, and I think Mr. Ando has done a good job at drafting this policy. But I do think we need to have more support, not only from the comment, but also from the nation. And because I don't want us to be on the island by ourselves, I want us, this is the best practice in transit across the nation. Because I agree with Lil, is that if we have so much disruption that people won't be able to get to work simply because a couple of people just do not want to adhere to the policy. So let's make sure that we're doing best practices, not only for Columbia or Richland County, but just doing best practices and we're following how the nation does it. So I want to have a little bit protection on this, where we're not on the island by ourselves. And if Mr. Ando can expound on that a little bit, I would appreciate it.
Yes, Mr. Huggins and the committee. We are doing this from best practices. That's why I know suggestions was brought up to us to do this earlier. We, at the time, didn't feel comfortable because we didn't know what other transit systems were doing. Participating in the APTA calls weekly. I've also participated in other calls with other transit CEOs where we're modeling our program based on what other transit systems have done. To give you a perspective of who's doing this, We have Foothill Transit in Los Angeles, California, the New Orleans Regional Transportation Authority in New Orleans, Louisiana, Charleston area Regional Transportation Authority in Charleston here is also have a similar policy. So we're definitely one of the earlier adopters of public transit system to do this. We've shared the policy with legal counsel and we've gotten their guidance. And additionally, we've also, some of the transit CEOs have commented on is that if your state law allows your board to set policy and regulations for the transit system, which we have validated that this board can do that, then if you're going to require people to wear a shirt or pants to ride public transit, there's no difference than requiring somebody to wear a mask to ride public transit.
A good point.
Well,
and my other point, Leo, on Leo's suggestion, I really want the marketing PR folks to present to this committee what the plan is, because if we don't market this the right kind of way, then we could be in a situation where we just be in a bad situation. So please.
Is Ms. Bino Reed on the line? Because we can answer that question. We did talk about that.
who is that?
I was wondering if Ms. Bino Reed is on the line or not.
No, I'm not asking for it today. I'm not asking for it today. I just want to make sure that when it's time to move, that this committee at least knows what steps we're taking to ensure that the public knows how we're enforcing masks. And it can't be social media. It has to be a grassroots type of thing, because everybody that rides that bus doesn't have an iPhone or a computer. So
I can tell you at least the initial plan, and we can give you more details next Friday, but primarily it'll be a press release to the community. Signs will be posted on every bus in the system. There will be social media, and then we'll also reach out to, like in the case of DART riders, the primary care facilities where a lot of our DART riders go. Our bus operators will be advising the process, and that's kind of where that 45 initial day period comes into play, by providing the mask based on what we're able to get, because it can start, as we continue this awareness, by the time we get to that end of the 45 days, everybody should know that a mask is required, and we would hope that people would have been able to purchase a mask or obtain a mask by that time.
Well,
And are we enlisting the help of, are we enlisting the help of our friends in the Midlands Transit Riders Association to help us get out the positive reasons why, and why this is a positive thing to do for riders, because it protects them rather than a burden to place on them?
I have not had a chance to talk with Charles, but that is a very good idea that we should use Charles.
Because they can generate a lot of conversation on social media that will help us both get the word out in a positive way, but also give us a little bit of an indication about how much pushback we might expect.
That's a good idea, and I think we can definitely get that conversation started with them. I can tell you a lot of those riders.
And I encourage, Mr. Chair, I encourage John to reach out to all the communications department, City of Columbia, Richland County, all those individuals, just to help us pass this word out.
As well as, I think this is a good project for Flock and Rally to do TV advertising and radio advertising and newspaper possibly. This would be a good way to reach people and let them know what we're doing. Now the major problem I have though is I just wish we could do something to have free masks for a duration, because I find that's going to be the big problem. I think a lot of people are going to come and they're going to tell you they can't find them. They can't say again.
Yeah, you're just concerned about the supply. I get it. Yeah.
No, I'm not concerned. You can get the mask. That's not the problem. The problem is whether we want to pay for them. That's what I'm thinking about. We need to be in a position to pay for the mask, because that'll be the big problem. And but I don't think most people, I don't believe, going to have that much trouble wearing a mask. Especially, nobody wants to get this thing. I don't care nobody wants to get it. And the other part that I worry about, well, you know, we're going to have to do the mask because we can't do a temperature check. That's what I've been pushing since day one: temperature check, and mask. But since we can't do the temperature check, we got to make sure that those masks are there to protect people. But John, that's what I'm saying. Do you think we can figure out a way to get more masks? Because 45 days, that'd just be what, the 1st of July, you say? The middle of July?
That'll be August, 1st of August. 1st of August.
Okay, the 1st of August, and we're still going full blast. We probably won't even have the barriers in place by then. So.
No, because we still need to come back. We'll probably be before the board at the July Board of Directors meeting to authorize purchase. So if we issue a purchase order after that meeting, assume at the minimum 120 to 180 days. But we'll talk about that at the next agenda item.
Okay. So I would say one of my big concerns, see if we can come up with enough money to buy masks to last through the duration. And I think that would take care of a lot of problems right there.
Mr. DeChamps, could you comment on that, if you don't mind? Do you think that's feasible, or I don't want to set ourselves up for something we can't do?
Yeah, now that to me would be, you know, what we're looking at and prices we're looking at now, that to me would be a tall order. You know, it would be it would be a good position to be in. And I think also too, as we get into this, I think the supplies of having that constant supply is going to be a challenge also, with everyone needing masks, and for us, you know, being able to provide them just constantly. That would be my concern.
Well, I wonder too if we get to a point where we might say we'll provide them free of cost up to this point, and then there may be, is there a way for people to purchase one when they get on?
Well, that'll be another whole series of problems for them to have to purchase them. But that's the weakness I see it. Now, I'm John. Let me ask you this: couldn't some of our CARES money, that the $15 million we got, or $13 million, couldn't some of that be used to purchase these masks?
Yeah, and we intend to use the CARES funding to buy the mask. Buying the mask is not really the issue. It's because it's the availability. I don't know. Is Mr. Harris on the line? Yes.
Where's your? Don't we have a
Harris, can you talk about your conversation with CARTA and how many masks they purchased and how quickly they've gone?
Yes, I don't have the numbers in front of me, but from what I remember, they originally started with maybe 100,000 masks, and they went through, I want to say maybe, was it 40,000 within a span of two or 3 weeks, something like that, like 2 weeks.
Mm-hmm.
So that's going to be the concern, is if CARTA is doing this already and they're going up to the mask super quickly and they run a slightly larger system than we do, I don't want to set us up for failure if we commit to always providing masks and for whatever reason they run out of supply and we just can't provide them.
John, let me what's our annual ridership under normal circumstances?
2.8 million passenger trips a year.
Okay, so I would think 2.8 million masks would be enough. I'm just using that as an example, and for as long as we do this thing. Otherwise, I can tell you right now, lots of people.
Mr. Chair, I'm sorry. I thought you were finished. I'm sorry.
Go ahead, Darren.
Okay, the thing that I think the staff is recommending is we phase our reaction program based on what the nation is doing. and the adaptation or the mutation of the virus. I would think for us to try to pin something where the virus could easily change. I think staff has done a great job saying 45 days, and it's in line with, I think, where the intel is coming from the governor's office and also out of the nation. And as far as transit goes, I think we have to transition based on, no pun intended, but we have to transition based on the plan of how things are acting after 45 days. So for us to try to pin this down based on a year or 6 months, I don't think it's wise for this committee to recommend that. I think it's wise for how staff is doing what they're doing, giving us good information, marketing plan, 45 days, and then after that, we readjust based on what the trend is across the nation, because we don't want to set a precedent and then fail in the middle of it. Thank you, Mr. Chair.
And Mr. Chair, I have one more thought on this too, and that is, you know, what I'm thinking about is that the habits that people have, where they have access to something that's free that would be useful to them. And I'm thinking about, you know, you go to a fast food restaurant and they have a napkin dispenser, and you watch people. I mean, they don't take a napkin for their lunch. They take a fistful of napkins. And so I'm trying to think about how do we how do we set things up to as well as we can to succeed. I mean, we're not going to be able to change human nature by setting a policy, but I just for us to kind of think through those scenarios of how to handle situations as that we can anticipate and as they arise in ways that are I don't want us to be confrontational if we can possibly avoid it. So I'm just trying to think of this myself, and I don't have any quick, easy answers, but I'd like our best minds on this.
Well, I agree with you, Lil. Now, one thing, though, we got to go ahead and bring this to a conclusion as to what we want to do, because we have another meeting at 1 o'clock, you know. That's
right.
15 minutes.
What do we need to do? Do we need to make a motion to adopt this policy or to recommend it to the board? What is the action we need to take?
Action is to recommend that adopt this policy. The board has delegated this committee to address COVID-19 activities.
John, do you think we've done enough? We got a whole lot of unanswered questions here. So do you think we've done enough background work to take this to the board for approval? I'm just wondering, because usually they're relying on us to bring good, solid recommendations there. Now we can do that, but we still need to answer some of these questions about whether we can have what we're gonna do what we'll do after August.
I mean, this policy is fluid enough to where, I mean, the purpose of this committee is to address COVID-19 activities as it's ever-changing week by week and sometimes day by day. So this policy is setting a framework to get us going to address some of the concerns of overcrowding on buses and to still continue the protection of our passengers. If something changes next week, we'll be before you again on Friday to advise you of the ever-changing conditions, and then this committee can give staff direction on how to address those ever-changing committees. But this policy is setting the framework of how we can at least get started with some of the concerns that we have learned in the last 3 months.
That's a good skeleton. And
Mr. Chairman.
But Lil, let this be the last question. Comment, please.
Right. Well, what I'm thinking is that even though it makes all of us uneasy, the staff included, how many things that really are unknown. What we realize is, as John points out, is that it's not a matter of if we wait a few days or we do some more homework, those unknowns will become known. There's just a lot of uncertainty in the environment. And so I think we need to go ahead and proceed. And I still was not entirely clear when John talked about the what the board is delegated to this committee. What I thought I was hearing you say, John, is that we can make a motion to adopt this.
Yes, the
policy.
board has
We don't-
delegated to this committee the ability to provide direction to staff on how to address COVID-19 activities. That's the
Okay,
whole
well,
intent of this committee. We will
All right,
still
so
present it to the board so that they're aware of the committee's actions, but
Sure.
this committee is authorized to direct staff to implement things.
Okay, so
Well, can I-
given
all right,
that, I
I'm-
make a motion that we adopt the COVID-19
Well,
policy.
Okay, well,
Okay.
okay. I'll second
Okay.
it, but I do have, I gotta have a little bit more discussion.
Yeah, well, that we can discuss.
Okay, what you have?
I second it. I second it.
Okay, properly moved in second. Go ahead, Derek.
It's very important, just what Leo was saying, that it changes every day. And it's gonna be
Right.
board members, and it's gonna be community people that's gonna be asking a lot of questions. So it's very important that we make sure our marketing and PR people have the right kind of words when those kind of questions come up. We don't know the answers, but we cannot just put a policy out there without some kind of indicating saying that we know that this thing can change, and we know what the sore spots are. Okay, so let's make sure that we just don't put a policy out there without recognizing that, please.
Oh, definitely,
Thank you.
and this policy will be fluid enough
It's much
to
work.
where.
It's much work as this committee has done. Great work this committee has done. We can't hang ourselves in a situation where it just goes down the drain if we don't structure the policy and the wording in the right kind of way.
You're
Well,
right,
John,
Mr. Huggins, and we intend to keep this committee apprised until this pandemic is over on ever-changing requirements. And if it means amending the policy to address it, this is why we're meeting weekly, is to give you guys that flexibility to give us that direction.
Sounds good to me. Okay, okay.
Well,
let's go ahead
actually,
let's go. Let's
Actually,
go ahead and
in
vote on this.
okay, you ready to vote? Because I was just going to say that
I'm ready to
actually,
vote.
in the worst case scenario, if we can't make the mask policy workable, what we have to do is back up and say, well, the only thing we can do is go back to the distancing, which makes services less available. So that's
correct.
not something we want to do, but that's our only kind of fallback position.
We'll work on that. That's very good. But John, I think they want to lay out the skeleton here, and we're kind of working and put other things in place as we go along. So with that being said, let's go ahead and vote on this. All in favor, let it be known by saying aye.
Aye.
Aye. So same here. Okay. That gives you the authority to go ahead, John, and follow the direction as you said in the motion. And
Next week, we'll present the marketing outreach on what we're doing to make sure that people are aware of this policy.
Great.
Yeah, okay, that sounds good. Okay. The next item on the agenda, and we don't have but a few minutes on this. Can we get an update on the item on the partitions? That's what they are, barriers.
Yes, this is a really quick update. We have, as I've mentioned previously, we have been seeking quotes to install partitions on all of our vehicles. Transdev is working on installing the interim shower curtains on 40 of our cutaways, as shown in your packet. We are getting ready to test a permanent barrier in the cutaways. We're going to start with one bus, and if it works out perfectly, it will be installed on all 42 buses, and that would resolve the cutaway fleet. The biggest challenge is the transit bus fleet. Because the transit bus fleet is larger and they're needing to engineer a design, that's why we haven't gotten a formal quote as of yet. However, our two vendors that we're talking to, New Flyer Parts and Complete Coachworks, are working on that, and we should be having some quotes for those shortly. We're also getting a quote to put in barriers in our two minivans as well. So I've given you pictures of what those barriers would look like. We have 87 vehicles ultimately that we would put some form of a barrier in. And to outfit the entire cutaway fleet, it will be about $40,000 or $952 per bus. To outfit the entire minivan fleet, it'll be about $5,000. To outfit the entire fixed route fleet at a cost of at least what staff is projecting, looking at what other staff reports across the country from transit agencies are paying, we're looking at $5,000 per bus or $210,000 for our entire fleet of 42 large transit buses. So the total cost of this project is $255,000. The vendors are telling me it's going to be about 120 to 180 days to construct and install due to high demand across the nation for the installation of these barriers. And it's my intent to strive to provide this to the Finance Committee in July and ultimately the Board of Directors in July to authorize the Executive Director to purchase. We would use our 5307 funds to pay for this at 80% federal and 20% local. I've given you specifications on what the barriers would look like once constructed, and I'll be happy to answer any questions if there are any.
I have a question, Mr. Chairman.
Go ahead.
Mr. Chairman?
Yes, recognize, Derek.
Okay. Mr. Anda, who's doing the specifications on this?
The specifications.
Who's writing the specifications? Who's designing this?
For the big buses, it's New Flyer. For the cutaways, we're relying on the vendors that are providing the quotes to us. So that would be creative.
Okay, so it's not the comment, and it's not someone locally, but these are specifications that's coming through APTA or coming through FTA or what?
No, these are specifications coming from the manufacturers based on how they built barriers in the past. A lot of these barriers that we're getting they're assault type barriers, so they'll also protect the driver from being attacked.
Very good.
Okay.
Thank you.
That's a good update, John. Appreciate it, and we're looking forward to that. If there are no other input on this, I'm going to ask for a motion for adjournment.
I move we adjourn.
Okay. Can I get a second?
Move.
Proper move and second. All in favor? Thank you very much.
Aye.
We'll see you next week.
Thank you.
See you next week. All right.
Bye-bye.
All right. We got 3 minutes, and we'll see you in 3 minutes. Okay,
Thank
bye.
you. Bye-bye.
Bye.
All right, you ready to transition to the next one?
Don, you sure you want me on this board?
I'm sorry?
Are you sure you want me on this board?
Oh, Mr. Mayor Walker, any help you can provide is greatly appreciated.
All right, Don, do you have it pulled up?
I don't.
Just because I don't want to leave anybody sitting there.
You're gonna pull it up on yours?